to stand on the protocol that has been established. Thank you and good morning, Comrade President. The picture that you have in front of you on social progression was a picture taken in 2015 of the President and the little children in the community of Tsumkwe. And Tsumkwe is the poorest constituency in Namibia, followed only by Opuo. And this photograph really captures the essence of the social progression pillar. While the economic advancement and its recovery components identify new frontiers and makes a thrust towards accelerated growth and development, the social progression pillar is anchored on the foundations for human development, towards social mobility, to alleviate and eradicate poverty, to reduce inequalities. It is about dignity and improved quality of life for Namibians, which is very central to the President's promise of prosperity for all. This pillar is founded on five goals and desired outcomes and 19 strategic activities. The first goal, in light of the impact of the drought and increasing vulnerability because of loss of livelihood, is to arrest hunger poverty and ensure that there are 0 deaths in Namibia from hunger. The second goal seeks to resolve the question of urban land, housing, and sanitation. Goal 3 looks to improve access to public health care. Goal 4 seeks to improve access and the quality of public education and sports. The final goal is a new and emerging social contemporary issue which has always been in our country, but there is a rising incidence and a need to intensify efforts to arrest gender-based violence and the violence perpetrated against children. I will now just do a top-line overview of some of the strategic activities that the government commits to undertaking during the term. Of the 19 activities, in order to arrest hunger poverty, there are 3 strategic activities. It will be to increase the production yields through rural extension services for communal farmers in crop-producing regions. It will be to determine a basic wage floor for minimum wage through the established Wage Commission. This process will have to be undertaken through wide public consultation. It will be to enact a special conferment bill that will enable the regularization and citizenship of currently undocumented and stateless persons in the country. We will also seek to, during the tenure, consolidate some of our social safety nets, specifically the food bank and the marginalized grants, into a conditional basic income grant. This will be done in a phased approach, and in the first installment, it would only be for the beneficiaries currently listed under the food bank and marginalized grant component. For Goal 2, to deliver on the question of urban land, housing, sanitation, there are 4 strategic activities. Through a collaborated and a coordinated effort between local authorities, the government institutions such as the GIPF, the Shack Dwellers Federation, and some development property developers, we are making a commitment to service and deliver 24,000 ARVN over the term. This is a commitment based on the resources that are available, and it will depend on the mobilized funding of these development partners. These ARVN have been are located countrywide, but priority will be placed on the areas where there is greatest need. The President declared in the 2018 Land Conference that the situation in informal settlements is a humanitarian crisis, and to this end he has charged the Ministry of Urban and Rural Development to spearhead the formalization and the upgrading of informal settlements. For the term, we are undertaking to upgrade 5 informal settlements across the country. We are also able to make a commitment of 20,000 housing units to be delivered over the term, but this is not limited to the collaborative and the innovative platform that will be forged between the private and the public sector in order for us to reduce the cost of housing and also to reduce the cost of land through some policy reforms on the national housing policy. For Goal 3, to expand access to public health care, we have a number of targeted activities, which include expanding infrastructure across the country in different towns. We have at least 5 capital projects that are on the lineup over the term. We also intend to modernize the central medical store to secure the supply of pharmaceuticals and clinical supplies in the country. We intend to expand and to decentralize certain facilities for non-communicable diseases so that there's access for radiotherapy, dialysis units at state hospitals in 5 different towns beyond Windhoek. They are currently all centralized in Windhoek. The Minister of Finance also spoke to the introduction of a national health insurance, and through the term, we will begin the process of nationwide consultations to restructure the public health sector and develop the necessary policy framework towards equitable access to public health care for all. Under Goal 4, really addressing the fundamentals to human development education, there is a capital outlay to increase and to improve the education infrastructure, which is classrooms, ablution facilities, hostels, and I would like to make an appeal to the private sector here to join hands with government because of the significant backlog in education social infrastructure. We will conduct the necessary reviews on the policy for integrated early childhood developments to improve the quality of ECDs and to increase the subsidies for educarers so that we can have a better product at the foundation that can make it through the education system with lower attrition. We have a number of activities under higher education, which include the establishment of a teachers' professional regulatory body, which is intended to improve the quality of the training of educators and to prescribe minimum standards for the profession. Jointly, together with the private sector, during the term, we will implement a national internship and TVET apprenticeship program to facilitate at work, integrate learning, and cooperative education. We will conclude the NASFAF sustainability model this term to improve fund administration, coverage, and loan recovery. We will also introduce industry skills committees for institutions of higher learning so that we can improve the curriculum reform through participation of the private sector towards a more demand-driven education system that is responsive to the economic transformation agenda. Finally, on sports is to professionalize 6 priority codes in the country. Under Goal 4, or the final goal, which is arresting gender-based violence and violence against children, we have heard the cry of the public, driven by civil society organizations with young people at the forefront, who have made very considered recommendations to the government, of which some have been included in the National Priority Program. We undertake to improve the training and the orientation of police officers, social workers, youth officers, towards a more empathetic, inclusive, and correct care for first responders and survivors of GBV. We make a commitment to creating specialized courts for the hearing of GBV cases at magistrates' courts across the country. We further commit to promulgating the National Register of Sex Offenders to ensure that a record of names is kept for those found guilty of sexual offenses, and to promulgate the Child Justice Bill, among many other legislative instruments, to demonstrate government's zero tolerance towards GBV and violence against children in our country. Your Excellency, this is the end of a very summarized social progression pillar. I would just like to reiterate that the social progression pillar is central to President delivering tangible improvements and to making sure that nobody in the Namibian House feels left out. Thank you.